Good morning, this is Melanie Daly here with the Daily Grind. We're here to discuss another workers' compensation issue over a cup of coffee. Today we are going to address the medical treatment guidelines. And as many of you know, the medical treatment guidelines have a certain amount of procedures and treatment that is already pre-authorized. You don't require authorization. Several of these include therapy, physical therapy, in certain type of injections and certain type of surgeries, including arthroscopic surgeries. Orthoscopic surgery. My apologies. But it's also important to look, even if it is included in the guidelines, it's important for you to actually really scrutinize the doctor's reports and its basis for the surgery. Because what we've seen is where doctors, they see that it's pre-authorized, they don't have to go through the hoops to jump through the hoops to get the authorization, so they do it. However, that pre-authorization that is in the medical treatment guidelines is assuming that the criteria is still met for that pre-authorization. Like the doctor's not allowed to just say she needs this surgery and just do it. It actually has to be a criteria. For one example, for a arthroscopic surgery to the knee, there are criteria that are required to be met. For example, one would be a repeat surgery. If it's a repeat, if they already had the pre-authorized surgery in the past, then they need to request that authorization for a second surgery. In one claim that we had, the doctor did perform a surgery. However, it was to the knee, and it was the arthroscopic surgery. However, he did not specifically meet any of the criteria. He kind of dabbled with each of the criteria in order to do the surgery without authorization. However, upon further look, he did not meet the guidelines as required. So therefore, it was very important, especially in this case, because this claimant had a prior injury that was the surgery that he ultimately performed. The injury documented in that prior claim was the surgery that he did. Therefore, it was technically a second surgery because the current injury did not meet any of the criteria. We won't go too far into the details because there are a lot of them. However, we just want to make it clear and advise you that it's very important to look at the medical records in order to ensure that the doctor is actually following the guidelines as required. If you have any questions regarding the guidelines, if you've had any requests for treatment or any surgery that has already been completed, you might not be on the hook for that because you have to make sure that the doctor has followed the guidelines. So feel free to reach out to one of us, and we are more than welcome, more than happy to help you. And we will see you next time. Thank you.